Hi, welcome to the Natural Way to Better Health and Wellness. I'm your host, Dr. Donald DeFabio. Well, you can stay healthy lots of ways, and it doesn't require medication or taking a shot. And that's what today's show is all about. It's how to stay healthy, not get the flu, not get a cold, and not take the flu vaccine. Natural health care is the theme. Today, our first guest is going to be Dr. Ira Shapiro, a chiropractic doctor, and we're going to talk about a wellness lifestyle. So, Doctor, thanks for coming out today.
It's a pleasure being here with you.
Now, just a little bit about you real quick. You've been a doctor for the United States Olympic team 2 times, I believe.
Yes, that is correct.
And you're also board certified.
In sports injury, yes.
Excellent. And you teach for chiropractic colleges, don't you?
Yes, on the postgraduate level.
So
yes.
you have a few years of experience under your belt.
Yes, I do.
Now, in terms of chiropractic, how does that fit into a wellness paradigm? How does it help people stay well?
You have to understand that the brain is the major control center of the body. And the way the brain tells each individual organ, tissue, or cell how to function is sending impulses through the nervous system. When there are what chiropractors refer to as subluxations, meaning there's interference in the nervous system, that particular part of the body is not going to get the full amount of impulses from the brain. Therefore, it's going to not function at close to 100%, more susceptible to breakdown. And that breakdown is what we refer to as disease. So if we can restore the full amount of impulses to that particular part of the body is going to function at more close to 100%, thus less chance of breakdown, less chance of disease.
Well, that makes a lot of sense. Now, how does that relate to the current craze on the flu, getting the flu? So can a chiropractic care or the wellness paradigm, how does that help you prevent getting the flu?
Because the flu comes really from resistance. It's when the body's resistance is down, then
the immune system's lowered.
Correct.
You're in a weakened state.
Right. That's when these types of disease processes come about, because the body cannot fight off the particular virus or bacteria that has entered the body. So the stronger the body is, the more the body's going to be able to fight off those types of problems. Again, the less chance that you're going to have these types of disease developing.
So we have chiropractic treatments, chiropractic adjustments, but come on, that can't be the only way to keep people well. Let's be honest,
No,
Doctor.
a very important thing is also diet and is exercise. Remember, if we ate a well-balanced diet, then we would not need to take vitamins and supplements.
Twinkie diet isn't going to cut it.
No, it's not, but really nobody we know eats a real, true, well-balanced diet. Mm-hmm. So in turn, that's when we need to take some supplements, depending upon what we're lacking in the minerals, the vitamins that are needed for our body to function the way it's supposed to. In that instance, we need to also supplement our diet intake with some form of,
nutraceuticals. We can,
right.
and things like that, which makes a lot of sense.
Right.
Now, what about rest? Where does rest fall into the picture?
Well, what happens is when we rest, that's when the body heals itself. That's when the body recharges itself.
Okay.
There's a lot of problems out there. For instance, when I got out of school and I was out for a period of time, and I was playing a lot of ball and running a practice and doing a lot of different things. My body, I was burning the candle at both ends, resulted in getting mono and mononucleosis because my immune system was depleted because I was burning the candle at both ends, not getting the proper rest, not getting the proper nutrition. Therefore, my body reacted it, and that was the problem I was having. That's why it's very important for rest. Of course, the older we are, the more rest we need. During the first 3 decades of life, remember, the body built itself up. Once you hit around 30 or so, then the natural healing processes of the body start to degenerate. So at age 20, when you got something happen to you, it might take you 2 days to get better. Right. At age 30, it might take you 2 weeks. At age 50, it might take you 2 months.
Well, clearly, Doctor, you're not over 30, so you must have learned that through research, correct?
I'm a little bit over 30, and no, it's from practical experience.
Well, in any event, it does make a lot of sense. We have exercise, we have diet, we have getting enough rest. Chiropractic adjustments, we've explained, thank you, was very clear on restoring nerve function to enable the body to work better so it's stronger. What about the brain? What about a positive mental outlook? What about spiritual balance? How does that fall into being well?
What we don't realize is how important our brain is, and how they say we use about 30% of our brain. And that those additional things you just spoke about are very important. A positive mental attitude and outlook on things are very positive to help the healing processes in the body. They speak about individuals who overcome cancer. They're the ones who have more of the positive mental attitude, the positive outlook towards things, and the body will respond in a positive way from a positive mental outlook.
Excellent, excellent. Well, this is what we want to get out to the viewers. We want people to realize that health really comes from within. And it's a process, as you quoted, a lifestyle,
Yes.
in which we really want people to embrace. It's not something external, it's something internal. Exercise, diet, rest, a positive mental attitude, chiropractic adjustments are all essential. So thank you very much for your time today, Dr. Shapiro, and hopefully people will start to embrace a wellness paradigm. Our next guest is going to be someone that can really talk to us about supplementation and nutraceuticals, natural occurring agents, herbs, vitamins, minerals that will boost your immune system to help that immune system stay stronger, assuming it's functioning properly if you have the other 5 factors of health. I'm Dr. Donald DeFabio. Today's chiropractic tip, whiplash. Do you know your headrest restraint geometry? That's HRG for short. That means keeping your headrest 2 inches above and 1 inch behind your head will reduce your risk of getting whiplash 78% from a rear end crash. Drive smart. Use your car to prevent whiplash injuries. I'm Dr. Donald DeFabio, reminding you that chiropractic is more than just back pain. Welcome back. Now we're going to talk about how to boost your immune system naturally so that you can avoid the flu and the flu shot as well as other health conditions by staying strong. Our guest is Dr. Nikki Conti, a naturopath, who's going to give us some insights on staying well. Doctor, thanks for coming out today.
Thank you.
Now, there are several natural agents out there that'll boost the immune system, correct?
Absolutely. There's a lot of things out there to boost the immune system. In particular, I'm thinking about elderberry. A lot of good scientific information has been put out by elderberry. It tastes sweet, so it's great for kids. You can have an elderberry syrup. And actually, the way it works is it helps the white blood cells work more better.
Really? So
Yeah.
it stimulates your body's white blood cells to, as you
Fight.
said, yeah, to fight better. Now, elderberry is an herb.
It's an herb.
So
it's
you
an
would-
actual berry.
It's a natural berry. So you would buy the berry or you'd buy the extract? How does
The
that come?
extract.
The
It comes in an extract form. You can get it in a syrup or in a tincture,
Okay.
or you can get it in capsules. I personally prefer the syrup because the effect of it as you're swallowing it helps your throat, and that's
Okay.
your first entry, so to speak, into your organs.
Okay.
And your throat has all the lymphatic system there, so you have your tonsils. And so the elderberry physically helps with that.
So gives
Sometimes
you-
it comes with zinc,
Okay.
and zinc is excellent as well, topically. So elderberry-zinc combination would be a wonderful way to boost the
They
immune
have
system.
vitamin C and zinc lozenges, for example. Is that
Exactly.
another good thing to use, or are there better agents than the C and zinc
I
combination?
think C and zinc combination is excellent. Sometimes they'll put in a little lysine, which is an amino acid that helps to combat all types of viruses. People know of lysine for like herpetic lesions.
That's a virus.
Yeah. Exactly. It's a type 1 virus, and usually people will get lesions in the mouth and stuff like that. So a combination of zinc, lysine, and vitamin C would be perfect. It comes in lozenges,
All right.
and they found that sucking it is better than actually swallowing it.
Wow. That's, now, why is that?
Because again, topically
So
zinc
it's
works
almost
better. It coats
and
exactly.
blocks the agents from attacking you
Attacking
and getting hold.
Yes.
Now, what about things like vitamin A? Is that beneficial for the mucous membranes, for the throat and the nose and
There's
stuff
been
like that?
several studies that looks at vitamin A in terms of exactly what you said, the mucous membranes and the lungs, the bronchial tree. And they're finding that extra vitamin A helps. You just have to be careful if you're pregnant. There's
sure.
a certain amount, do not exceed more than 5,000. But fish oil or cod liver oil has a lot of vitamin A already built in it, and it also has the vitamin D built in it. And so you're getting more, more for your money, so to speak.
So
by having
going
that.
back to my mom, who got her tablespoon of fish oil every day, every morning as a kid.
Cod liver oil.
Yeah, exactly. The
Yes.
cod liver oil that's actually something that we want to keep. We don't want to throw that baby out with the bathwater. It was actually an effective treatment,
It was
wasn't
a great treatment to help boost the immune system, the lungs, the whole digestive system even. And now it comes in different flavors, so you don't have to have that horrible taste.
Well, no offense. I still don't like the flavored ones.
Well, you could get
personally.
it in capsule.
Okay,
you
that
can
that
get
I
it
can
in
do.
enteric-coated capsule,
All right.
so that it bypasses the
that
taste.
you got me on that.
And then a trick that I found is you can put it in your refrigerator or in your freezer and have it in the middle of your meal.
Okay.
So
good.
that's a good way.
So it settles and passes through.
Right.
It doesn't come back.
But fish oil is a great anti-inflammatory
All right.
agent. So it decreases inflammation. And when we think about this time of year, a lot of things are inflammatory to the system. So we want to decrease the inflammatory pathways. And fish oil is an excellent way to decrease the inflammatory
So
pathways.
fish oil, you have cod liver oil, but you can also get it as a supplement too, correct?
Right. You can get, it
Just
will
basic
be
fish oil pills.
omega-3
Omega-3s.
fatty acids.
Got it.
It might say EPA, DHA. It's also great for kids in terms of brain function. So a lot of kids who are on that spectrum, the ADD spectrum, do very, very well. It's great for skin, again, decreasing the inflammatory pathways. It's great for eczema, psoriasis. It's great for adults in terms of arthritis. It's just like the cure-all.
So how
in a
much
way.
would say, first of all, we got to give the caveat.
Yes.
We're talking general information.
General.
We're not giving specific dosing requirements. Always check with your doctor if you have any questions about the supplements we're discussing today. How's that sound, Doctor?
That
Appropriate?
sounds really good. But the information out there is that you need at least 3,000 milligrams of fish oil. That's what
Now, is
the
that
research.
active ingredients or is that the total amount of fish oil?
The total amount of fish
Because the
oil.
active ingredients are different. Because you
Right.
could have 3,000 milligrams of fish oil, but only 500 milligrams of active ingredients.
Right. The active ingredient, EPA, in specifically, would be 900 milligrams. So you're
Got it.
looking at maybe each tablet has 300 milligrams, but that's for an adult person, and that's what the research was based on.
Excellent. Excellent. Well, we always want to bring evidence-based information out
Always.
to our viewers. So we're going to do some EPA, we're going to do some DHA or some fish oils. Some vitamin D, you had mentioned, is also very good at boosting the immune system.
Vitamin D, the more research that's been out there, and a lot of doctors are on the bandwagon with vitamin D these days, what we're finding is that a lot of us are depleted in vitamin D. And the only way you would get vitamin D is if you stood out there naked for 20 minutes each day. And who does that?
Without sunscreen.
Without sunscreen, exactly. And what we're finding is that vitamin D is so great for the immune system. It even protects against certain forms of cancers, they're finding out. It's
Excellent.
great for osteoporosis and osteopenia.
So how much vitamin D in an adult? What should they be taking?
It depends, because I would say get your vitamin D levels checked. Sometimes you need anywhere from 1,000 to 50,000 IUs, depending on how
So a simple
depleted
blood
you
test
are.
can do that?
A simple blood test would do that, but if somebody just wants to maintain, I would say about 1,000.
All right.
Again, for an adult.
That makes good sense. Doctor, we're going to take a short break, and then when we come back, we're going to talk more about some nutraceuticals and the stress response and how stress impacts
Excellent.
our health, because we want to stay healthy, and staying stress-free or fighting stress is part of that. I'm Dr. Donald DeFabio, and my guest is Dr. Nikki Conti. We'll be right back. Today's chiropractic tip, joint pain. If you get sharp pain in a joint or pain in a joint that recurs with activity, that's a sign of pathomechanics. Pathomechanics is abnormal joint motion. Chiropractic adjustments restore normal joint motion. So if you're getting joint pain or stiffness in your joints, see your doctor of chiropractic. It may be just what you need. I'm Dr. Donald DeFabio, reminding you chiropractic is more than back pain. Welcome back. Doctor, stress is a problem when it comes to staying healthy, isn't it?
Huge. We're always stressed, especially in this part of the world. And stress, long-term stress, has been found to be very deleterious to our health and certainly diminishes our immune system.
How can we combat that? Do we take anti-stress supplements, or do we take immune-boosting supplements to combat that?
A little bit of both. We're finding that there are some things that you can do, like exercise and things like that, which you might cover better than me. But in terms of supplements, you can test. Actually, there are some tests that you can test your cortisol and DHEA.
Okay.
So
Cortisol is an adrenal fight or
an
flight
adrenal.
hormone, and DHEA, that's your adrenals if you're getting overstressed. So go
right.
ahead.
So there are some functional labs that will actually test for those things.
Excellent. And
So-
then based on that, you can make a recommendation.
But for the average person who knows that they're already stressed, there are some things that they can do to help themselves. For example, B vitamins, especially B5 and B2 vitamins, are very great. They're very great. They're great for stress relief. I always tell people to take B vitamins either morning or afternoon, because that's when your stress response really kicks on. Not to take it at night, it might keep you up.
Okay.
So B vitamins become very important. So maybe a B complex to do that. There are some herbs like ginseng. Licorice is very good for the stress response. You just have to be a little careful with licorice if you have high blood pressure,
I've heard that.
because it will bump up the blood pressure a little bit, at least 10 degrees. So if you have high blood pressure, I would say stay away from licorice. But on the other hand, if you have low blood pressure, if every time you get up and you feel kind of lightheaded, then licorice is wonderful for that. And licorice is great for kids as
Sure.
well. It tastes sweet. We're not talking about the Twizzlers. We're talking about real licorice. And so that's a wonderful way to give kids a little licorice, like panda bears or something like that. That's out there.
Excellent.
There are some other herbs like ashwagandha, which is an Ayurvedic herb. It's from the
India.
Indian tradition that also helps. So you might find something that has like a stress relief combination, I would say. So go to the health food store and find something like that. And again, take it morning and afternoon, but never at night.
Got it. Now, you mentioned a couple of herbs. In prior segment, you talked about the anti-inflammatory, the response of the fish oils. What about doing that with herbs? Are there herbs that also create an anti-inflammatory response in the body that we can reach out for?
A lot of herbs are what we call adaptogens. So they help you either way. So all the herbs that I just mentioned, the ginseng, the licorice, also have anti-inflammatory properties.
Okay, and spices? What are any spices?
Curcumin, turmeric.
Okay.
They're that yellow orangey
Got it. Ginger?
herb.
all of
Ginger
that?
is wonderful. Cinnamon
Okay.
is
All right.
another wonderful thing. So I tell people to put cinnamon in their oatmeal in the morning or even in their coffee grind.
All
It's wonderful to decrease inflammation.
All right. So now let's get back to first of all, a lot of information. We're not going to be able to cover it all. Can people contact you if they have any questions?
Yes, I do have a website.
Is that the best place to get you?
Yes.
What is your website?
It's www.nikkiconti-naturopath.com.
All right, great. Well, hopefully you'll be getting lots of clicks on that because
Yeah.
I really appreciate this
And
information.
I do a lot of talks
right,
at the
good.
Watchung Hills High School
All right.
and different places. So if you go on my website, you'll get all that information
Excellent,
as well.
excellent. What about other immune-boosting agents? Mushrooms, do they work?
Mushrooms are wonderful. There's some medicinal mushrooms, for example, shiitake or maitake. But now they're finding that even your regular button mushrooms could be very helpful. You could make a mushroom soup. Just be careful with the cream part of it. But they have been found to be helpful in cancer. They help to boost the immune system. They help to boost the white blood cells and the red blood cells because people's immune system gets really depleted in times of stress.
Wow. Okay.
So mushrooms are really important,
works well.
and they don't cause any kind of. People are worried about mushrooms and yeast and all of that. They don't have to worry about the medicinal mushrooms.
You know, that brings me, now we've kind of come full circle. We started with supplements, now we're talking about food.
Yes.
What do people need to do to stay well, to avoid getting sick with their food? What do they need to do?
Well, the best thing to do is to stay away from sugar and refined carbohydrates. So I tell people if it's made from white flour, stay away from it. The pizza, the cookies, all of that. Pasta. And you can get rice pasta, by the way. It tastes pretty good. Because the research shows that sugar decreases the immune system. It decreases the neutrophils, those white blood cells that go
That
out.
the elderberry stimulates, right? See, I was listening.
Yes, you were. You get an A. But yes, so the white flour decreases that.
So lots of fruits,
Lots of fruit, lots of vegetables,
live food, and stay away from the cakes, candy, sweets, and white flour.
Pizza.
Pizza. There you go. Dr. Conti, we're run out of time. A lot of information. We look forward to having you back as a guest again. But people need to understand that they can take charge of their health.
Yes.
And that it's not coming from a shot, correct?
Absolutely.
You know, you don't need to take a vaccine shot to stay away from the flu. You need to eat right. You need to exercise. You need to reduce your stress level and manage it properly with nutraceuticals. Get enough sleep. So I'm Dr. Donald DeFabio, and the next segment is going to be interesting. It's going to talk a little bit about pain management, both the aches and pains of colds and flu, but more importantly, chronic pain. We'll be right back. Today's chiropractic tip, wellness. Research has shown that periodic chiropractic adjustments improve spinal function indexes and reduce overall medical expenses by 20% annually. Your health is your best asset and your only real wealth. Take care of it. Call your local doctor of chiropractic for an appointment today. You deserve it. I'm Dr. Donald DeFabio, reminding you that chiropractic is more than just back pain. Welcome back to The Natural Way to Better Health and Wellness. I'm Dr. Donald DeFabio. Aches and pains of colds and flu affect all of us, and we get through those once the virus or the bug or the irritant in our system goes away. However, sometimes people get chronic pain, daily pain that occurs regardless of what they do, and frequently gets worse with activity or gets worse with weather changes. And now we're going to talk about how you can address chronic pain, especially in the smaller joints of the body. Dr. Ira Shapiro is here with me today, and you're going to talk about something called the Isotherm, which is a new advanced technique for chronic pain. Doctor, what is the Isotherm?
Well, the Isotherm is a handheld device, and it's based on Thornburg's thermal grill. And Thornburg
is that a tongue twister, Doctor? Thornburg's thermal grill?
Yes.
Do we say it 6 times fast and then we get to keep the Isotherm?
Yes. It was first demonstrated in 1896, and the concept behind it is that if we take a grid and on 2 sides we put cold at about 20 degrees centigrade, and the other 2 sides we put heat at about 40 degrees centigrade, where the 2 intersect, there's no feeling at all of hot or cold. And that's the same concept with the Isotherm. By using the device and intersecting the cold with the hot, it's going to block the pain sensations from the nervous system to the brain at the site of your injury. And that's the main concept behind the use of the Isotherm.
So now, this is more for chronic daily type pain, isn't it?
It's for chronic pain, meaning pain that's been around for a long period of time. It's best used on individuals who have repetitive or overuse type injuries. Remember, what separates most humans from other animals is our ability to grasp. So over a period of time, if somebody uses their hands all the time, over a number of years of doing it, that particular joint is going to break down. And when it breaks down, that's when the pain sensations come about from overuse. The Isotherm, by turning around, and we can see right through in here as we point it to the camera, we have blue lights and we have yellow lights or red lights. Though one is cold, the other is hot. And where they intersect, that's the area where the thermal grill effect takes hold. And by placing that on a particular part of the body, right, that's the area you're going to treat. This works extremely well on the small joints of the body. The fingers, the wrist, the elbow, and it also works extremely well with conditions like plantar fasciitis on the bottom of the foot, and a little bit of Achilles tendon involvement on the bottom of the foot.
Okay. Now, when we come back, I got a question for you about how it works, like how you do it. It looks pretty straightforward in the length of time it's used, but we just had a chance to talk to the inventor, John Seringer. I interviewed him over the phone, and we want to hear his take on why he came up with this device for chronic pain. So let's hear from John Seringer with a phone interview. At this point, John Seringer, you're the developer of the Isotherm. What was your vision in managing chronic pain? Why did you come up with this idea?
Well, I guess I've seen the I've seen the effects of chronic pain in patients using my other products, and I always thought that there's got to be some way of treating patients with pain not using drugs that was non-invasive and safe. And I just researched it until I came up with it.
And this concept of using the hot and cold at the same time is something you've been researching for several years, hasn't it?
That's right. Yeah, from the fundamental research to determine that in fact it was an efficacious way and an effective way of treating pain was done in the early 90s.
And what's really exciting too, you seem to have a passion to make the Isotherm accessible to the general public, don't you?
Absolutely. I mean, it's just a matter of self-esteem that I like to come up with solutions that impact the quality of life for a lot of people.
Well, John, you're clearly doing that, and we appreciate your time today. And we look forward to lots of people getting relief from the Isotherm and your research. Isn't that great? He's really focused on helping people get their lives back. Now, from a clinical aspect, how long does somebody treat themselves with the Isotherm?
The Isotherm is usually used for about a 10 to 15 minute interval.
And does a doctor need to apply this? Is this a doctor-provided service?
No, it can be provided either in a doctor's office. I rather prefer the patients use it at home on their own.
So it's a home device?
That is correct. I equate it a lot to when people use TENS units.
What's a TENS
muscle
unit?
stim. That's a little goes on the belt, and those little electrodes, feel that electrical sensation in there, and those are designed also to block pain, but they use electrical impulses. We are not using any kind of electrical impulses. We're not putting anything into the body. This is solely from the thermal effect by blocking the impulses.
So it's just superficial?
That is correct.
So nothing enters into the body, no radiation, no electronic waves, no EMFs, no nothing?
That is correct.
And it blocks pain?
That is correct.
What types of patients have been using it in your office?
Well, remember that I do use a lot of sports injury, and so I find it a lot with individuals pitchers who are throwing the ball on a regular basis, or quarterbacks getting pains in their elbows, some form of Little League elbow or tennis elbow. I get a lot from tennis players who are gripping the racket, getting pains in their forearms, their wrist, their fingers. I also a lot of times use it with people in construction trades who are either screwing things in all the time, using a screwdriver, using a hammer. They're those repetitive types of activities. And remember, I can hit you in your arm one time, no big deal. I do that 10,000 times, you're going to get a welt. Same type of thing with the repetitive injuries. Over a period of time, from continually doing your activities, the body's going to start to break down in that area. By using the Isotherm, we can control the pain that happens from the breakdown in those areas in there.
Now, these people are using it at home on a daily basis then?
Pretty much so on a daily basis.
Or on an as-needed basis, yes, because if the pain's there, you apply it, and if the pain's not there, you don't apply it.
That is correct. And again, it's about a 10 or 15-minute protocol. You just very easily place it over the area where the pain is and hold it in that for 10 or 15 minutes. It's not where you have to move it around. You can keep it right on the area where the pain is right on the joint.
What about snapping fingers, trigger fingers?
Well, you get a lot of that with Nintendo thumb. This way,
There
you
you
also
go.
get it with trigger finger. Yes, this is very good for especially works extremely well the small joints of the body.
Now, if people have questions about the Isotherm, if they want to talk to you about it, can they contact you?
Yes, I can be contacted either directly at my website, which is plazacairo.com, or I can be contacted in my office in Old Bridge, New Jersey at 732-723-0023.
All right, terrific. The Isotherm, it's drugless. What about safety? Any precautions?
None whatsoever. There's been shown to be no adverse reactions to
So
using this device.
you're telling me
at
the Isotherm affects chronic pain in small joints, hands and feet, elbows. You're telling me that it's totally non-invasive, no electricity, no electronic waveforms, no EMFs, electromagnetic fields go in the body, and you're telling me there's zero contraindications for it.
That is correct.
It's a no-brainer.
That is correct.
Well, Dr. Ira Shapiro, thank you very much for coming out today. We appreciate your time. And if anybody has any questions, feel free to contact Dr. Shapiro. I'm Dr. Donald DeFabio. Thank you for tuning in and empowering yourselves to live better, move better, and be healthy. Have a great day. Hi, I'm Dr. Donald DeFabio, and I want to share something with you. Something which, if you have chronic pain in your hands and feet, can be a lifesaver. It really can. It's called the Isotherm. The Isotherm is a simple handheld device that has little hot and cold sensors on it, 40 degrees and 20 degrees centigrade, respectively. But the bottom line is it blocks pain. You can use it on the small joints of your hands. You can use it on the small joints up to your elbow. You can use it on your feet. It works, it blocks pain, and it enables you to get your life back if you're suffering from chronic pain. It's safe. There's no contraindications anywhere in your body. It doesn't create electricity in your body. It doesn't create electronic waveforms in your body, EMFs. It doesn't enter into your body at all. It's totally superficial, but it does block pain. So if you need an Isotherm, talk to your doctor. He can supply one for you.